Roger's infrared magnifier. Just to add on to that comment about information, I think we need to be very careful how we define information. So I always think of the tendon field following on a little bit from the osteoarthritis field that used to be called degenerative joint disease, then osteoarthritis, because they couldn't really be convinced there was an inflammatory process going on. But it's pretty well universally accepted now it's osteoarthritis because of the cytokine milieu that drives the degeneration or the damage to the joints. And I think we don't necessarily have to have cell populations, white cell populations there to have inflammation. There are inflammatory cascades orchestrated by the resident cells as well as inflammatory cells, and as Steph Bacon's work has shown that there are macrophages in small numbers that we don't recognise unless we label for them specially. So I think we have to be careful on what we're defining as inflammation. And just a quick point to add to that, I think the other importance of inflammation is potentially staging the disease process. The big difference we see, I think, in veterinary medicine compared to human medicine is that you often are dealing with clinically much more advanced chronic stage disease, whereas we tend to see it early, and that's when the imaging is particularly important for identifying, and we monitor these animals every 3 months with cross-section areas, Doppler, off-incidence, everything. And we think that that makes a big difference to outcome, but we also have data showing that the extent of the original lesion impacts on prognosis. So I think those things match together in terms of trying to stage the disease. We should probably do that more carefully, would be my suggestion.
And I think that the concept of having a definition of tendinopathy and an algorithm that links the clinical picture and the imaging is important, but I think we truly need to define what we mean by inflammation, because we throw it around, the expression around, and I don't think any of us actually knows what we mean when we say it, and I think every person means something different when we say it.
It's really, in clinical practice, it's really important that we try to define this discussion about inflammation or neuroinflammation in tendons, because 90% of my patients, they've been on NSAIDs for months before they come. So out among the general practitioners and our colleagues, there is an impression that these tendons are inflammatory. So it might be good if we can come to a conclusion within a couple of years or so.
Hi, Angie here, I'm from Australia. I've done a little bit of histopathology and clinician. So the histopathology I've looked at is on chronic tendons and bursa. It's not in the acute phase, and when we looked for inflammatory cells, not so much the cytokines, we saw almost nothing in either of those tissues. In the acute phase, it's very hard to get people to donate their tendon and bursa when they've got an acute episode going on. Leading on from that, and thinking about what Ed was talking about in pain, I don't know that clinically we can differentiate between someone who's having increased event of their pain and whether that's being centrally mediated or whether it's actually a biochemical event happening in their tendon. And so I think we need to be really careful about our definition of inflammation. Are we talking about cytokines, or are we talking about someone having an acute pain event in their tendon history, and is that really something that's inflammatory, or is it nociception pain event?
Okay, I think we might have exhausted that sort of perspective, and I don't know that we've advanced a lot, but at least I guess we're going to expose ourselves to the podcast population out there, how much we don't know and how much we don't agree, so it'll be very interesting.